Healthy women and children are the foundation of a strong future. Investing in them improves health, empowers women, and drives development. Yet for decades, financing for women, children, and adolescents has been inadequate, unpredictable, and fragmented, slowing progress and resulting in preventable deaths. The Global Financing Facility, or the GFF, was launched in 2015 as a new way to fund the health and rights of women, children, and adolescents. Hosted by the World Bank, it aims to unite partners behind one national plan, align investments, and mobilize more resources. As part of the Countdown to 2030 initiative, a collaboration of mostly African-based researchers, advocates, and policymakers set out to investigate the GFF in the first 7 years. The team reviewed 54 GFF plans and project documents from 28 countries and interviewed key informants from 4 countries, resulting in 9 academic papers. They assessed national investment cases and GFF-linked World Bank project appraisal documents. So, what did they find? First, the GFF has raised the profile of women's, children's, and adolescents' health and mobilized $14.5 billion since 2015 through World Bank projects. Second, GFF grants make up 4% of this total. Most of this funding comes from government and low-interest World Bank loans, but many country stakeholders did not understand this. Third, in many cases, the national investment cases did not fully align with the final World Bank project documents. So, while the GFF is a huge opportunity, their grants are tied to these projects and countries face trade-offs, taking on loans and narrowing priorities. The study also assessed who was at the table when developing the GFF documents. The GFF model emphasizes country leadership and evidence-informed decisions. In practice, power, politics, and external priorities also influenced the process. Sometimes, key decisions were made by a small group without fully engaging others like the civil society, youth, and the private sector. Finally, the GFF has shown openness to learning and adapting with improved data platforms and evaluations. Yet deeper reforms are needed in financing models, governance, and ensuring what's planned is delivered and measured for impact. Strong, independent accountability mechanisms are essential to make GFF investments truly catalytic. Now is the moment to act. The GFF's future trajectory will have even more influence than before. Countries in turn must lead, bringing all voices to the table and committing real domestic resources. Learn more in the Global Health Action Special Series on the GFF.